kind of side effects have you experienced so far, and how have you managed the side effects?
Just like every breast cancer is different, every patient will react differently to the side effects of chemotherapy. They're not so nice. I think I almost breezed through them because of how I approached them. You know, when the chemo goes in and kills off cancer cells, it also kills off a lot of good cells.
Of course.
It's not very discriminating. It tends to kill off a lot of the inside of your, I guess, your stomach and your intestines. At one point I said, the aliens have taken over my digestive system. I don't own it anymore. I don't control it anymore. But once again, there are medications to help. You know, there are wonderful anti-nausea medications. Granted, they might slow down the digestive system.
Yeah.
So it's always kind of this balancing act. But we live in an amazing age where there are great medications to help, and there are ways to deal with, you know, some of the crummy digestive issues, which we don't have to completely go into here. There are also, I mean, let's just say it, balding,
Yeah.
no hair.
You know, I want to stop you for that, because this is a very good thing you're bringing up right now. You said there are people, because of vanity, I don't want to lose my hair.
Oh,
I'm
yes.
not going to go through with this. They're risking their lives because of vanity. Can I tell you a quick story? My mom, who lived 22 years, she was 80, into her 80s, so she had a great life. She had breast cancer. She didn't like the wig. She didn't like, that's how vain she was. She says, I don't want to wear a phony wig. I'll just rather go around bald. That's the way she...
Well, wearing a wig is not the best thing in the world. Your head gets hot. When during the summer, your head can get itchy, and, you know, it's not great. But for me, and everybody, again, is different. I mean, I've met some women who walk around bald and they look so darn good. It's like, stay that way. For me, it tends to make me feel a little bit more normal. Do stuff, stay at work. If you can, keep working.
Well, I was going to ask you, how much are you working? And you know, in the midst of the treatment, can you work?
Again, it all depends on how sick a person becomes. You know, I was able to stave off a lot of the crummy effects of chemo, I think, because I made a decision to work with a nutritionist. I made a decision to eat clean. I took sugar out of my diet.
And that's hard to do, because everything has sugar.
It is very, very hard to do.
But you said there's a lot of food without it.
I will admit, the first time I heard from the nutritionist that we were to take out sugar, dairy, and wheat, there was this quiet pause as I was thinking,
what am I going to eat?
What's left? And I feel so much better. I dropped about 25 pounds. That was kind of a side effect of it. I didn't go into it for that, but obviously it's good for you in that sense. I stayed active.
Have you cut out any work at all, specifically?
Yes. I did not stop working, but I did kind of change the way I work. I don't go into the office every single day. I work from home a lot, but I still work all day long. I used to be on the road a lot, giving speeches, doing media campaigns. I was on the road a lot. And that was the one thing that my oncologist put the kibosh on. They said, well, you're going through chemo like this, and your white blood cell count and your red blood cell count is so low, and that means you don't have a lot of immunity. We don't want you flying around on commercial planes.
Do you have special accommodations right now, like more opportunities to rest during the day, to do things?
Well, yes, in that I do a lot of my work from home, but having to cancel out of some of the speeches that I was already booked for in the fall, I will tell you that was the hardest thing I've ever done.
You feel you're letting people down.
I had never canceled out on a booking ever in my entire career. And when she sat there and looked at me and said, I want you to cancel out of all of these speeches that are like all over the United States, I just couldn't even imagine myself doing it.
Because did you feel you were letting people down?
Yes.
That's what I'm saying, yeah.
I felt I was letting people down.
Yeah.
But you just have to understand that your number one priority has to be fighting the cancer and making sure that you don't put yourself at any kind of health risk during this really aggressive form of chemotherapy.
I knew Jim Valvano very well. When he was diagnosed, he came home and told his kids, "I'm sorry." He was apologizing to his kids for getting cancer. Do you understand that emotion?
Oh, yeah. I mean, you know, when you're a person who, especially as a woman, we're caretakers. We're used to taking care of everybody else in our lives.
Right.
And it makes it difficult to all of a sudden accept the fact that other people are going to take care of you. I found that really difficult. I found it difficult to accept the care. And I kept saying, you don't need to go with me to this appointment. I can go by myself. And my husband and my older daughter would say, yeah, we're going with you.
Right. And you think it's a great thing.
And you know something?
Don't go alone.
I think it's really important, if you have this opportunity, to take a loved one or a good friend with you. Because I will tell you that in some of those first appointments, it was almost as though their mouth was moving, but the doctors were saying, wah, 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 because I was just in another zone.
Sure. It's a lonely fight for a lot of people. They're not famous. They don't have big families. They don't have a lot of wherewithal to do those. They have to go alone.
And this is something I think that the medical professionals really need to keep in mind. They have to keep in mind each and every individual, especially women, because we're the ones that are taking care of the house, that are making sure there's groceries, that are doing the laundry, that are getting dinner ready, that are making sure the kids have what they need for the school year. And then you're also trying to manage this chronic illness and all the side effects. You know, it just wears women down.
Sure it does.
And don't be afraid to ask friends to cook you a couple meals that you can put in your refrigerator, so that when you feel really lousy at night, that you don't have to work so hard to make sure that your family has food on the table. I mean, those things are equally as important as the medicine that you prescribe.
So well said. So well said. Until the time you started as a reporter on Eyewitness News, I'm going way back in the mid-70s.
Now we're going way back.
No one in those days spoke publicly about cancer. I mean, Betty Ford, Happy Rockefeller, they had a change when they spoke publicly about their own breast cancer. But 40 years later, there's absolutely no barriers, it doesn't seem like, to talking about these issues via every available form of media, and you've been doing it. What are your comments on that? What does this openness mean, do you think, to people regarding the prevention or living with breast cancer?
I get messages from women all the time saying, I had breast cancer, 20, 30 years ago. I'm a 25-year survivor. And when I had breast cancer, no one talked about it. I mean, I think, nobody used to talk about how smoking would kill you. All of a sudden, we got an entire nation talking about it, and we changed the behavior, and we made the country healthier.
Yeah.
We need to do that right now with breast cancer. We need to make sure that women understand that what their risk factors are. I'm going to be really honest and candid again. I thought I was somehow immune to breast cancer because I didn't have a family history.
Yeah.
Only to find out, after I was diagnosed, that only 15% of women who get breast cancer actually have a family history.
Is that right?
Yeah.
Wow.
I used to think, I don't have the BRCA gene.
Most people would feel that way, though, the way you felt.
I just felt that I didn't have any of the risk factors, so I never have to think about it. Well, let me tell you, you don't have to have any of those risk factors, and you can still get breast cancer. So it's really important that from a young age, and I say that as an emerging young woman in your 20s, that you be your own best health advocate and make sure that you are aware of your breasts, that you notice if anything is different. Like if you had an open sore that changed on your body, you'd go to a doctor and you'd say, what's wrong with that? We have to make sure that somewhere along the educational horizon, whether it's in school or maybe it's that our gynecologists, which, women tend to go from their pediatricians to a gynecologist, and sometimes that's their first line of defense. And in many cases, it's the only doctor they see. I've never been told by a gynecologist about dense breasts. I had never heard of it. And women need to know that. And they need to understand that even though they might not have what we usually call the risk factors, I'll tell you one of the biggest risk factors, obesity.
Yeah.
You have a lot of fat on your body. Estrogen is stored in the fat.
Sure.
So it's pulsing through your body, and that's one of the things that's feeding the growth of breast cancer. I didn't know that. I didn't know that until after I got diagnosed and I learned it from one of my oncologists. I think if a lot of women understood that and knew that, they might think twice about, whether they need to lose that extra 10 pounds and decrease the amount of body fat that they have in their body if they didn't think about it as in terms of fitting into a size 6 or 8 gene. If they thought of it in terms of decreasing their chance of getting breast cancer that might kill them, maybe they'd take it a little bit more seriously.
You're talking about education, awareness, and then there's the other one, overcoming the fear and the stigma
Yeah.
of going in there to get analyzed, to get the whole procedure, everything done right, so that people aren't saying, I don't want to find out, I don't want to know.
And it's
you talked about
unfortunate that a lot of women think that way.
Right. Well, when we were doing makeup, I heard you say something that surprised me. You said, this is the new me. Maybe that's a good thing, though, in a way. It's the new me because you're looking at your life differently.
Yeah.
It's the new me.
You can't dance with death and look it in the mirror and not change. And doctors all need to really be cognizant of that, too. You become more appreciative of life, of your friends, of your family, of your home, of your ability to do things. You change as a person.